Thanks very much for being with us on the programme. Let's just be very clear about this. It's very early stage of research, isn't it? But what have you actually been able to show?
So what we show at this stage, which is, as you mentioned, very early stage, is that our model shows an association between the number of deaths and cases of COVID-19 and air pollutants. And we use a few markers of air pollutants, and we show there seemed to be an association between those two factors. And so we also saw that other studies found similar things as we did. This is very encouraging at this stage, but also we need to stress that this is preliminary finding, and we're still looking forward to exploring this link further at this very moment.
Yeah, so as that research carries on, and as you said, there are other studies as well that you're obviously able to look at as well. I mean, do you think, though, that the correlation is real? I mean, why would more polluted areas be at risk?
So one of the main hypotheses is that pollution causes our lungs to be in what we would call as constant or chronic inflammation, and this sort of damages our lungs in the longer time scale, and that leads to a poor response to coronavirus or to other infections. And that's also seen during other pandemics, like the SARS coronavirus for one.
And presumably there are other things that you have to rule out. I mean, there could be it could be more to do with different income levels in different areas, or different age groups living in different areas as well.
Yeah, so right now we have that data. We are still doing the analysis. We're going through a lot of different variables. There are variables that we know have an effect, like age. That's one of the main variables that has an effect on coronavirus-related cases and death.
And just finally, as many areas, especially here in Europe, start to head towards, or at least talk about heading out of lockdown. I mean, we've been hearing lots of calls from environmentalists to make it a very green exit from a lockdown. I mean, your initial evidence seems to support that need.
Yeah. So basically, one of the things that we've been exploring is whether, so after lockdown, right, there's an improvement in the air quality, and maybe that improvement will lead to fewer cases than expected after the lockdown, because the air has been much better. That's only speculations, but it's hope.
Yizhou from Cambridge University, thanks very much for being with us on the programme today.